My name is Amal Nirgotkar. I'm the CEO of Patient Prism, and I'm delighted to welcome Holly Mitchell from Central Park West Dentistry here. And Holly is a phenomenal speaker and a lecturer and coach, and she has really built one of the most exciting practices here in America. They have been in Inc. 5000 for the last 5 years in a row as the fastest growing, one of the fastest growing companies in America. And you know, as you build an organization, one of the things that you have to deal with is obviously people. And when you're dealing with people, sometimes there is the D word, which is drama, right? No matter what you can do, drama will always exist in every organization as long as people come together. There'll always be some sort of a tension that we call drama. And so what have you done really? Because obviously you've grown really fast, and how do you keep drama intact, and how do you kind of control that to an extent?
I think the first step is understanding where the drama is coming from.
Okay.
And it's really a desire for people to feel significant. They want to feel respected and heard and appreciated.
Sure.
So it's really up to the leader to establish that ear for them, that respect and that safety.
Okay.
So this, back in the day, in my early days as a leader, I played a role in the drama triangle.
Okay.
So in the drama triangle, it comes from a transactional analysis in psychology from Dr. Stephen Karpman. And he talks about 3 roles. There's a victim, a persecutor, and a rescuer. And so you can't have a drama triangle without those 3 roles. And so usually the victim will come to you with a problem. This person is making my life miserable.
Sure.
Okay.
Sure.
And so as the leader, you're supposed to solve the problem. And so you want to jump in and rescue. And I felt great about being a rescuer.
Sure.
Because I was a problem solver. I had the answers, people respected me, they wanted my advice, and so I would swoop in and save the day.
Nice.
But fast forward to doing that every day for many years, and what happens is burnout and resentment. And so there is a cure. The rescuer needs to become a coach. So when someone comes to you with a problem, you coach them to find the solution for themselves. And there's some great coaching questions that you can use. Some of them are, is this a one-time thing or is this a pattern?
Sure, sure.
So then you're bringing perspective to the problem. It's really, really up to the leader to not be emotionally reactive to whatever's going on. Because if you're reactionary as a leader, what do you think happens with the team?
Absolutely. And that happens quite a bit, especially in any organizations, especially dentists who are leaders of their practices, and sometimes somebody says something crazy, and they're like, oh my God, I have to react, and all of a sudden hell breaks loose without actually going through the process.
Yeah.
And sometimes, do you think the leader, do you think somebody else should, if they don't know how to handle being a rescuer and a coach, do you think somebody else should handle that role in an organization? Do you handle that in your practice?
Not always. It depends.
Okay.
So we've got a hierarchy of leadership, right?
Okay.
So the person goes to their, well, you want to go to the person that you're having the problem with first.
Sure.
That's the first step.
Okay.
So if somebody comes to you as a leader and says, I'm having a problem with somebody else, you say, did you talk to that person yet?
Okay.
And usually the answer is no.
No.
And so then you can coach them through how to have the conversation. And then once they've had the conversation, if they're still having the issue, then they get to come back.
Sometimes timeout is so essential, right? Sometimes emotions get really high, and if you just let time pass, even an hour pass, things kind of calm down and things don't appear as grave as they are supposed to be.
Yeah. I think that it's easy to get sucked in, right? Because we care. We want everything to be great. It's totally normal to get sucked in. But the way you react initially to any news, right, no matter what it is, this is usually my go-to. Somebody comes in my office, you know, they've got a problem and there's a lot of emotion going on, and I'll go, huh. That's me giving myself a little bit of space. Huh, that's interesting. Okay, let's look at that. Right. And then we're stepping outside the problem and we're looking at it objectively.
I think when people take themselves out of that situation and look at themselves from a distance, sometimes you realize it's not a big deal. How have you? But what if there's people say I can't work with this person at all? Either they stay or I stay. How do you handle that?
Oh, that puts you in a really tough situation, doesn't it?
Sure.
And I would probably speak to that.
Okay.
And I would say, that puts me in a really tough situation to have to choose between the two of you.
Sure.
Don't you think there might be another way to solve this problem? And if they're willing, I think that that's the right person I want to work with. If they're not willing, maybe it's not a good fit.
Because it happens all the time. I mean, whether it's a dental organization or any other organization, there's just heads, butt, and there's strong personalities. Is that something that you can handle initially through some psychological profiling when you hire the right type of people? People use DISC, people use other profiling systems. Because if everybody is just headstrong and it's hard, right? Because nobody's going to work together.
Well, I'm not afraid of strong personalities as long
Okay.
as you frame it in the right way.
Okay.
If you think about it like a sports team, right? Well, everybody who's on that team got there for a reason,
Right,
right? They're
right.
bringing a certain skill set, but not everybody's the quarterback, right?
Right.
So we have to understand what are all of our strengths that we bring to the mix, and then we have respect. And there's some things that are changeable, and there's some things that we get to live with, and it's a trade-off. And so we have to learn to accept each other.
And as long as I think we give each team member the due importance and make them feel that they're part of the team and equally important, and so that their insecurities are kind of taken care of, I think we can kind of reduce the amount of drama that goes on, or handle it better in terms of coaching that person.
Yeah, and it really is all about communication, isn't it? I think any problem with culture is just the result of a conversation that never was had, that needed to be had.
That's fantastic. I think we should continue more of these conversations. What a fantastic segment on drama in the workplace and how to avoid that. So thank you, Holly.
You're welcome. Thank you.